Hello, I'm Stefan Tolan with the Stephen Hawkins Clinic of the Carolinas, and today I'd like to talk to you about arthroscopic rotator cuff repair. The purpose of this video is to give you an idea of why you might need this procedure and what to expect during and after the rotator cuff repair. The rotator cuff muscles are small, strap-like muscles that lie underneath the deltoid and surround the shoulder joint. Their job is to provide the power to lift and rotate the arm. The tendons of the rotator cuff are the extensions of the muscles that insert onto the humeral bone. As one ages, these tendons become thinner and are prone to rupture, sometimes with minimal injury. In the younger patient, rupture is usually associated with a significant injury. When the rotator cuff tears, it usually does so where the tendon attaches to the bone. Unfortunately, these tears do not repair themselves. Leaving them unattended may lead to progression of the tear size and increased symptoms. The surgical result is also better with smaller tears, so delaying surgical treatment may lead to less satisfactory results. The symptoms of rotator cuff tearing are usually progressive loss of strength and power and pain. Typically, the pain is also present at nighttime. Eventually, significant loss of motion and strength may occur. The main reason to repair a rotator cuff tear is to improve the pain. A secondary reason would be to improve power and strength. However, these results may not be as predictable. An arthroscopic rotator cuff repair is a minimally invasive procedure, but is still a fairly major operation with a prolonged rehabilitation period. The results are generally very good, but even an excellent result does not always give you a normal shoulder. The surgery repairs the torn tendon back to the bone, but your body has to heal the repaired tendon or the repair will pull loose. The procedure is usually done on an outpatient basis, meaning you will have your surgery and go home to recover on the same day. For medical reasons, some patients may be admitted to the hospital for a one-night observation stay. You will usually have a pre-operative appointment at the facility where your surgery will be, and there you will talk with the doctor that will administer the anesthesia. Usually general anesthesia will be used. Additionally, a nerve block may be administered prior to the surgery to diminish the post-operative pain. The procedure itself takes about an hour to an hour and a half to complete. A very small skin incision is made to place the camera into the shoulder. This is called a portal. 3 to 4 additional skin portals are made around the shoulder to insert the smaller shoulder instruments necessary to fix the tear. The camera is used to thoroughly check the shoulder for other problems, such as a biceps tendon tear. These other problems can be addressed at the same time as the rotator cuff repair. Typically, there is also a bone spur present above the rotator cuff that may have contributed to the tendon tearing. A burr is used to remove the spur on this bone to make more clearance above the rotator cuff. This is called an acromioplasty. The end of the collarbone is also a typical place to develop spurs that can rub on the rotator cuff, and these may need to be removed as well. If the joint at the end of the collarbone is very painful and arthritic, the burr can be used to remove a small portion of the collarbone to decrease the pain in this area. This is called a partial claviculectomy. The camera is then used to inspect the rotator cuff tear. It's very important to determine the size of the tear and also the quality of the remaining tendon. If the tear is repairable, then the tendon is reattached to the bone with anchors and strong stitches. The bone anchors may be metal, plastic, or absorbable. At the end of the procedure, the portals are closed and a light compressive dressing is placed. You will be taken to the recovery room until you're ready for discharge. You will also be given a prescription for pain medication and a follow-up appointment at the Stephen Hawkins Clinic and a second appointment with physical therapy. Your therapist will be given specific instructions on your case. The complication rate for our arthroscopic rotator cuff repair is low. Nerve and vessel injuries are rare. However, the main concern is that the tear may pull loose from the bone. Additionally, less than 10% of patients may also develop stiffness in the shoulder, and a small portion of these patients may require a second surgery to remove the scar tissue if their motion does not improve with therapy. It is important to remember that not all tears are repairable. The remaining tendon may be damaged and not able to hold the stitches, or the bone may be too soft to hold the anchors. Some may have lost too much tendon tissue to have the tendon repaired back to the bone. Most tears are able to be surgically repaired to the bone, but your body must heal the tear. It's also important to stay with the prescribed restrictions from the physical therapist and your surgeon during the post-operative period. Additionally, refrain from tobacco or tobacco products during the post-operative period to allow the tendon to heal. Recovery from a rotator cuff tear is usually a long process. Even the small tears require 6 to 8 weeks for the tendon to heal back to the bone. Full healing may require up to 6 months. Usually by 6 to 8 weeks, the sling is discontinued and activities of daily living are allowed. Office work may begin the week after surgery, but more physical jobs and sporting activities require a longer healing time. For most tears, 6 to 9 months is required to return to unrestricted activities. Arthroscopic rotator cuff repair is a safe and effective procedure to treat rotator cuff tears. Each case is somewhat different, so your surgeon will discuss additional information as well as your expected outcome with you.